Have you ever been asked to sign a HIPAA privacy notice form when you've been treated at your doctor's office or in a hospital setting? In general, you may know that HIPAA deals with a patient's right to privacy, but do you have a clear understanding of the protection that it offers as you sign those papers? Perhaps you're considering changing jobs, but you're concerned about losing your health insurance because you or someone in your family has a chronic illness. Do you know how HIPAA can protect you in this situation? HIPAA is an acronym that stands for the Health Insurance Portability and Accountability Act of 1996. Developed by the Department of Health and Human Services, the primary goals of the Act are: 1. To provide privacy standards to protect patients' confidential health information and medical records. 2. To make it easier for people to keep their insurance when their employment situation changes. And 3. To help the healthcare industry reduce administrative costs. HIPAA is divided into 5 sections that address different aspects of health insurance reform. The 2 main sections are Title I, which deals with portability, and Title II, which focuses on administrative simplification. This chart shows the 5 sections or titles of HIPAA. Let's take a closer look at some of the basic protection we are afforded under HIPAA. Title I, Portability, contains requirements that help people keep their health insurance when they lose or change jobs so they don't have a lapse in coverage. It places limits on exclusions for pre-existing medical conditions and prohibits discriminating against people based on their health status and medical conditions. It also guarantees health insurance policy renewals. In the past, some people were reluctant to change jobs for fear of losing their health care coverage. Thanks to HIPAA, folks in that situation have legal protection. Title II, Administrative Simplification, includes the Privacy Rule, which sets standards for the use and disclosure of an individual's protected health information, including our health status, treatment, and payments for health care. This applies to all protected health information, including paper copies and electronic data. The Privacy Rule also gives patients the right to examine and receive a copy of their health records and to request corrections. Some of the basic administrative requirements placed on healthcare entities include: develop a written policy and procedures to protect healthcare information. Designate a person to develop the privacy policy. Designate a contact person to distribute information and investigate complaints. Train the workforce on the policies and procedures. Develop procedures for individuals to file complaints about compliance. Help lessen any harmful effects caused by disclosure of protected information, and maintain reasonable safeguards for protected health information. Under the administrative requirements, healthcare entities are also forbidden to retaliate against people who file a complaint and cannot require anyone to waive their rights under the Act. Title II also establishes uniform standards for transmitting and maintaining healthcare information. It requires all providers to use unique identifiers and encourages them to change from paper records to electronic records to improve security and lower costs. Health plans, healthcare clearinghouses like billing services, and most healthcare providers must comply with HIPAA. Title II's enforcement rule outlines compliance, investigation, and monetary penalties for violations of HIPAA. Monetary penalties vary depending on the type of violation and range from $100 to $50,000 per violation. Title III, Medical Savings Accounts, provides for deductions for medical insurance. It specifies the amount each individual may save in a pre-tax medical savings account. Title IV, Group Health Insurance Requirements, sets the rules for group health plans, including requirements for continuing coverage and pre-existing conditions. It clarifies the requirements under the Consolidated Omnibus Budget Reconciliation Act, or COBRA. Title V, Revenue Offsets, has provisions regulating company-owned life insurance policies. It also deals with taxes on people who are believed to be giving up their U.S. citizenship for tax purposes. HIPAA is an acronym that stands for the Health Insurance Portability and Accountability Act of 1996. It's a U.S. law developed by the Department of Health and Human Services that sets standards to protect our medical records and other health information. HIPAA standards apply to health plans, clearinghouses, hospitals, physicians, and other healthcare providers. They give us access to our health records and places restrictions on how our information is used and disclosed. HIPAA also makes it easier for us to keep health insurance when we change or lose jobs. It is composed of 5 sections or titles. Title I, Portability, allows people to keep their health insurance when they lose or change jobs and limits exclusions for pre-existing medical conditions. Title II, Administrative Simplification, includes the privacy rule and uniform standards for transmitting and maintaining healthcare information. Title III, Medical Savings Accounts, provides for deductions for medical insurance. Title IV, Group Health Insurance Requirements, establishes rules for group health plans, including those related to continuing coverage and pre-existing conditions. Title V, Revenue Offsets, regulates company-owned life insurance policies and addresses revenue offsets.